Good evening, everyone. I'm Gary Christenson, Mayor of Malden. Today is Wednesday, May 13th, 2020, and we're coming back together to give our update as to what's happening around Malden relative to COVID-19. Before I do that, as always, I want to thank Malden Access Television for partnering up with us to be able to bring you tonight's broadcast. I also want to thank our Chief of Staff, Maria Louise, who's here in studio, socially distant, as well as Ron Cochran, our Communications Director, who is helping to also assist in tonight's show. I know many of you have asked over the past several weeks, what are some of the intangibles that has helped us navigate our way through this pandemic? We've had our police chief on, we've had our health director, we've had our human services director, but some people have asked beyond some of the great public servants that we have, what are the other ways that we've been able to make our way through? So tonight, I'm happy to answer that question as we have three panelists that are joining us here this evening. First, she needs no introduction. We have Gabriella Snyder Stelmack, Executive Director of the Bread of Life. We're also joined by Kim Bridge, who is the lead organizer of Malden Neighbors Helping Neighbors. And finally, we have Christian Lanphere, who is the Cambridge Health Alliance Safety Officer and Emergency Management Director. So what I'd like to do is what we always do, is to get a couple introductory remarks from them as to how things are going from their vantage point. And then, most importantly, we want to hear from you. So without further ado, I'm going to have our Communications Director, Ron Cochran, segue over to the panelists for introductory remarks, and then we're going to get to your questions. But before Mr. Cochran does, I want to stand up and I want to give them a bow for all the work they have done since the pandemic started. Hats off to you all. So let's hear from them. Mr. Cochran, who you want to go with first?
Okay, thank you, Mr. Mayor. I hope you can hear me okay. We were having some, we're going to go ahead with Kit Bridge. So Kit, go ahead.
Hi, everyone. My name is Kit Bridge. I'm here representing Malden Neighbors Helping Neighbors. We are a mutual aid group that came together in mid-March. All of us are just regular Maldonians. We've never met each other before this, but we've built a really tight bond as a group, and other Maldonian citizens have volunteered. We've been doing things like picking up prescriptions, doing grocery shopping for folks who are immunocompromised or sick. And it's been really rewarding and really inspiring to have be a part of this entire process. So I'm looking forward to answering any questions folks might have, either about asking for help or about volunteering.
Okay, great. And thank you once again for everything you've done. I mean, like you said, this has been completely initiated by you and the fellow residents of Malden, and we just couldn't be more grateful for what you have done. There's nothing more reassuring when someone asks us for something that the government might not be able to easily address, and being able to turn to your organization has really been a lifesaver for us all. So again, thank you.
Yeah,
Okay,
I mean, it's really, oh, sorry.
I'm sorry. Sorry about that. Go right ahead, Kit. You still have the floor.
No, I just wanted to emphasize, it isn't me, the person behind all of this. I mean, it really is legitimately lots of people spending a lot of time, people who are teachers and worked part-time and all sorts of other things to make it happen. So
Okay, great.
It really is a collaborative effort.
All right, thanks again. All right, Ron, our next panelist.
And once again, my apologies on that one, Kit. Next, we're going to go to Gabby. Gabby, go right ahead.
Yes, I'm Gabriella, the director of Bread of Life. I've been really proud of our team as well. As soon as, right after March 13th, We switched our evening meal at the First Baptist Church, which was a congregate dining situation, into grab-and-go meals. And actually, the need for that has increased 50% over the course of time. So we do have, and we've got social distancing. People are able to just pick up the meal from the lawn, from a table in the lawn, and leave. It's working very well. We also immediately converted our food pantry, which is a full order of groceries, the non-perishables, fresh produce, bakery, meat, dairy, into grab and go. And we have minimal paperwork. People ask about ID and so on. During the crisis, we're checking in pantry members, but we're not taking any new applications. We are serving everyone that comes. And the demand has more than doubled. So it's been a huge increase. We're working on getting more food, bigger trucks, more shopping opportunities at the food bank in Boston. And up to 80% of the people coming are new. They've never been to our pantry, or many never been to any pantry, and they are out of work, just what you'd expect, and really finding it tight.
Well, Gabby, you've...
thirdly, we started delivering to... Did you lose me?
Nope, go right ahead.
Oh, okay. We started a delivery program, so now we are delivering to people who are self-isolating, COVID positive, or elderly or disabled. And we're using volunteers, including the Malden Neighbors Helping Neighbors.
Yeah.
So that's been working great and growing.
And that was in effect today, because I participated in a Mass Senior Action Council Zoom meeting. And it was so great to hear that Bread of Life has just this week or late last week helping out at Suffolk Manor and some of the other facilities within our community. So you've been a real inspiration, and if you need further proof of that, as we're talking this evening, there's a concert being held by Malden's own Generation Gap happening on YouTube Live, where all the proceeds raised are going to the Bread of Life. So once again, thanks for always being there for us. All right, so we're going to go to our final panelist.
Thank you, Gabby. Finally, we're going to go with, yes, Christian Lanphere is joining us from Cambridge Health Alliance. Go right ahead,
good evening. My name is Christian, and I'm good evening. I am the, my name's Christian, and I'm the hospital administrator up at the Everett Hospital, and I serve as the corporate health and safety and emergency management director for the Cambridge Health Alliance system. What I would say is that the Cambridge Health Alliance was one of the hardest hit hospitals in Massachusetts from this virus. And so I think we've learned a lot, not only about the virus, but about just how we manage this as a system. And most recently supporting Malden's efforts through public testing by standing up a drive-through testing system at our Malden Family Health location to test the community who want to be tested, both from a symptomatic and asymptomatic perspective for both Malden and Everett. And we're quite happy with that operation at the moment.
Yeah, well, thank yous all around. Again, I still remember when people were calling us, asking us to try to figure out how to, do more testing. And, of course, we had never gone through something like this. So to have Cambridge Health Alliance contact us and volunteer their organization to help us with this overwhelming question that we receive from people about doing more testing, we want to publicly say thank you to you for your efforts this evening.
Okay. Well, thank you for everyone for their introductions. And we do want to get right to everyone's questions. I hope that's where we're going next, Mr. Mayor.
Yeah, just a couple of notes before we do. You know, we are continuing to work our way through this. Just this evening, we had another conference call with the Metro mayors, which included Mayor Walsh from Boston, and we're all anticipating what Governor Baker's going to do next week, and then we're going to react accordingly. One good thing that really happened today that the community can feel good about, City Council President Jadine Seeker, working with the high school principal and teachers and staff, were able to distribute signs to put on our graduating seniors' lawns and windows throughout Malden. According to all the feedback we're getting, the families and the graduates were just really moved by this outpouring of support. So we want to say thank you to all of them for coming together to make this happen. And we're going to continue to do signs tomorrow and I believe Friday, and we should have them all up by then. So with that being said, the other thing that we can announce, as of this morning, the City of Malden has 985 confirmed cases. We're down from what our daily average was, but we still have, you know, a lot of work ahead of us. So I think at one point we were in the, you know, 30 to mid 30 per day of positive cases, and now we think we're around 15. So we want to obviously get that down to 0, and we won't stop until we do. So let's get to the questions.
Okay, we have a few questions right off the bat here, so which is great. And we do want to remind everyone that you can, the number to dial in studio is listed on the lower part of everyone's screen right here. It's 781-388-9394. And then you can watch us on local access on either Verizon or Comcast, as well as streaming on YouTube Live. Our questions that we're fielding are coming in through our Facebook page, but also we're going to be looking at the YouTube live stream as well. Our first question is, I believe this is going to be for Christian. Any possibility of expanding to the test site for CHA to test for antibodies?
All right.
So I think this is a question that comes up a lot, and you know, we would like to get there. There is no FDA approved serology test as of yet. There are some tests that are working their way through the process. We have been working closely with the Broad Institute on a serology test, but there is no definitive test as of yet that has been approved by the FDA for launching.
And Christian, can you explain the importance of one day being able to do that for some of our viewers?
So sure. So the serology testing is very different than the nasopharyngeal test. So the nasopharyngeal test, just so people understand, it's a very thin type swab that we insert up your nose to the back of the nose. Really, it's very uncomfortable. And what we're looking is we're trying to pick up virus. You know, that test really tells us something about the virus presently, and if there's enough virus for it to be detected to determine whether you're positive or negative. It does have a false negative and a false positive rate, about 30%. So it's not, you know, it's not foolproof. Whereas the serology testing, it takes blood samples, whether it's you know, a tube of blood, or we use a prick of on your finger and take a drop of blood. And what we're looking for is if you have the antibodies. We're testing for antibodies to the virus. So for folks, why it's important is for people who may have been asymptomatic, which means they didn't have any symptoms of the virus, and may not even know that they've been exposed, they may have developed antibodies. And that is going to be critical for us to move forward, because if there's strong belief that the virus, that people have enough immunity in their system to, in the event that they do get the virus, they can fight the virus off, you know, and that basically progresses to herd immunity, then, you know, we're able to reconvene once again like we used to as a society. So
Christian,
it is critical
if you had
that
to,
we get there hopefully soon.
If you had to guess, when do you think we might have a FDA approved test?
You know, we're several months out. I think what I do appreciate about the FDA is that the FDA has been issuing a lot of emergency use orders as of late. I think the most recent one was the remdesivir, which was a hallmark. I think it's not something that's going to be guaranteed to save folks, but what we do know is that the emergency use orders that the FDA has been putting out there have been very good, and they've been very promising. So my hope is within, well within the fall. My hope is,
right,
if not sooner, would be better.
Right. Thank you. All right. Our next question.
Okay. Our next question. We do have a caller. We have Ernest on hold. Ernest, go ahead. You are on the air with the panel.
Good evening, Ernest.
Good evening. How are you all doing?
Good. Good. How about yourself?
I'm doing good, thank you. I was just wondering how you said that there is a conference call between all the other mayors.
Yep.
And I was just wondering if one city goes down in the positive cases, and you have another city that goes up in with a spike, would that person who may work in that other city have to, would stay home from there, correct?
Yeah, that's what they're wrestling with right now, how to balance that going forward. As a matter of fact, I heard for the first time the term reclosures, meaning that if they are somehow able to restart where we once were and there is a spike back up, they may have to go back to where we were. So that's why I personally think we've come this far, and so we have to be, very careful in terms of moving forward. But one of the questions I asked, I think, is along the lines of what you were asking, is if you get to the point where you reopen many things within our economy, and there is one community or maybe tri-city of a hot spot, would you reclose the entire state, or would you instead try to really hone in on the city or the cities around it that have had a resurgence of the virus? So that's what I think we're going to find out in the coming weeks. But it is something that is on everyone's mind as to how to address that in the future. And
Okay.
Christian, I don't know if you want to add to it, but that's the best I know from the public point of view.
Yeah, I think Mayor, you're right on about that.
Yeah. So
Okay, no problem. Thank you.
Thank you, Ernest.
Bye.
Okay, our next question, I'm going to kind of field this one on behalf of the community, because I think I've had to answer this question about 200 times in the last 3 days, and that is, where can the community get masks? And I think this is spawned by two things. One is by the recent order that
Right.
came from the governor, but then also a lot of, it seems like it's the Wild Wild West out there in terms of cities' distribution of masks, why they're choosing to, how many they're choosing, why. So I'm going to kind of put that one to both. We're going to go to Kit first and just talk about how Malden Neighbors is helping in that effort. And then hopefully we can go to Christian after to talk about what he might, some insight on why one city might be doing it one way and another way. But Kit, go ahead.
Sure. So Malden Neighbors, Helping Neighbors has distributed at this point hundreds of cloth masks, many of them just donated by members of the community who are getting involved. We also have organized a more organized mask making effort where we are cutting cloth, sourcing cloth, having things sewn, and we're working to supply them not just to individuals in the community who need them, but also working with other local places to make sure that they're supplied as well. So we are providing masks for those who ask for them. If you are in your home, compromised or going out isn't possible, we have volunteers willing to deliver them as well.
Okay.
And we have a steady supply right now, at least coming every week.
And Kit, can we provide your email address and phone number for people that are interested?
Sure. Actually, the best place to go is our website, maldenneighbors.org. And on that website, there's a help request form that will get you to someone on our end the fastest, because the entries that come in from there are triaged the most quickly, because they don't require phone intervention. Right. We do have a phone number for those who cannot, and that's also on the help page of it's on the contact page of our website, is the phone number. But if you have a specific request, the web form is the right place to go.
Okay, great, thank you. And Mr. Cochran, do you also want to provide Captain Cronin's contact information for people who have no other means of obtaining a mask as another resource?
Absolutely. So we can go to Captain Cronin's email address, which is gcronin@maldenpd.com, and also he's listed on our website under the emergency management department, and his phone number, which I'll pull up in just a second, is right there.
Okay.
And I will get that in just a second.
So did you want to have Christian weigh in as well? I know we've talked internally, and if we were going to do something, we wanted to do something that was going to last, right? Is that what you and your fellow members on the emergency management department are looking into?
So really, I think the supply chain system has been so heavily backlogged by just the drastic need for masks. My recommendation is to go to a cloth mask, one that can be washed. I've been so impressed by the community at large, particularly in the hospital system, when we were so in need of personal protective equipment for our frontline staff. The community just went to work and started making masks. It was incredible. I think what they've done. There are a number of YouTube videos. There's stuff online that people can make masks very easy. So long as it's a mask that fits properly, but also, doesn't, is not overbearing on the face, but also provides a nice tight fit. Is really, I think, all you need. The most important thing is that it needs to cover both your mouth and your face, or in your mouth and nose. But what I would also say is just as important as the mask is, hand washing is vital as well. 20 seconds hand washing. I just can't stress that enough. And as someone who works in the healthcare environment and is used to washing using Purell type alcohol-based systems, this virus really just valued just the importance of hand washing. If people wash their hands really well, you can really help protect yourself against the virus. But homemade masks, if you cannot find another mask, if you have no other means to get a mask, there are very easy ways of making masks just from t-shirts and other household products.
Yeah, so Christian, I can see that has been understated. We hear more about the mask than we do about the hand washing. So we should compliment Elena Savina with our organization, who put together a PSA around washing hands, and the importance of that. Because I think that's been lost, not lost, but it's certainly understated after, wearing a face mask. So it's good you brought that up.
Yeah, and I just can't underscore, this is not an airborne virus. This is not an airborne disease. This is a droplet disease. And the best way to describe that is when people sneeze or spit, that's the kind of stuff that when it gets into the air, that is, to me, is what people should be most concerned about. This doesn't live very long in the air. But if it gets on the surfaces and you pick it up on your hand, this is where people touch their face. That's where they're going to get the virus. And so by good hand hygiene, that's really what we're trying to impress upon not only our staff, but while protecting their face. And the reason why the mask is such a critical factor is that when people are actually, subconsciously touching their face and they don't know it, they're more likely to infect themselves by whatever's on their hands touching their face. And that's why the mask has become a critical component. But I just can't say enough the importance of proper hand washing.
Okay, great. Thank you.
It's critical.
All right, Mr. Cochran, where do you want to go next?
So we do have a caller on hold, but just prior to that, you did ask, I think you were asking about our internal emergency management protocols. And I think what we had discussed as a team was, I think there's some concern for the long-term viability of a mask, a massive mask giveaway now, because I think the thoughts of our emergency management director, Captain Cronin, were how do we then address the needs of upcoming things such as even return to school? Maybe we might have to offer multiple masks for students. And also we're outfitting our public housing and some of our senior housing already. I think what the best thing to take away from this all is that if you need a mask, we will get you one. We're opting not for mass distribution. However, if you need one, we will get you one. So please reach out to us in whatever way you feel comfortable, either by calling our office, 781-397-7000, or by visiting our Facebook, Twitter, any of our social media, or email info@cityofmalden.org.
Okay.
With that said, we're going to go ahead to our caller. Our caller on hold right now is Maureen. Maureen, go ahead. You are on the air with the panel.
Yeah, good evening. Excellent program. I was just wondering the number of cases and deaths. I didn't hear that.
Yes, Maureen, thank you. We have 985 confirmed cases as of this morning. And sadly, we have 67 deaths.
Oh.
So, our thoughts and prayers go out to the families. We actually did a small memoriam this week through our social media channels and on our website. And I know the City Council has been doing moments of silence.
Oh, that's excellent.
Yeah, and some of our team has been reaching out to some of the families affected. So please do the same on your end.
Oh, I will, definitely.
Yeah.
Well, thank you, and good luck with it all.
All right, thank you, Maureen.
Good night.
Good night.
Okay, our next question is for Gabby. Gabby, we would like to know, or the caller would like to know, what is being done within your staff to keep not only your staff safe, but also the exchange of, any goods, or when you're handing out food. If you could maybe talk about that process, and then also elaborate on are you still serving folks in need in the same way that you were prior to this?
Yeah, thank you. Good question. So for the staff, because that's so important, because we have many volunteers. It's one of the hallmarks of Bread of Life. So one of the things that we've done is limit the number of volunteers in different spaces. For example, for our evening meal preparation, we now have our staff. So we have 3 people in the kitchen, which is quite large, and we also are now using the dining hall as we're able to put things together in terms of bagging the meals, and then just a few volunteers every night. So this followed naturally because almost all of our partner groups pretty much immediately said, we're not able to come and volunteer and do group activities, and they've continued to sponsor a meal financially, or donate food, donate masks. So they've been great, but not coming in to actually volunteer. So we have a lot more control over that. And of course, everyone always wears gloves in a meal program and washes their hands, so important, and hairnets. And now we've added the masks. And then when the bagged meal is brought out, and this is all for the evening meal program, we have tables set up on the lawn at the First Baptist. The meals are put on the table. We have volunteers and our doormen that are making sure that patrons are at least 6 feet away from each other and from any of the staff and volunteers. It's worked very well. They come to the table, they get the number of meals they want, they get we call it the goodie bag, the sandwich, the fruit, the juice, the desserts, and then they've been leaving and eating the food elsewhere. So that's worked fine.
Gabby,
At our pantry, yes.
I was going to say, if someone had a question, how would they get in touch with the organization during this pandemic? Is it best by phone, email, both?
Yeah, they can email us at the info@breadoflifemalden.org, or they can phone, and actually Patty Kelly, who's our development director, has stepped in to being fielding a lot of the informational calls, and that calls will get forwarded directly to her because she is working off-site.
And what's the number?
781-397-0404.
Okay. And did you want to add something about the pantry? I'm sorry.
Yeah, at the pantry, we do have the social distancing. No one comes inside the facility at 54 Eastern Ave. It's all in the parking lot. It's all pre-bagged. It used to be choice. You'd come in and be able to have some selection and interact. Everything now is pre-bagged. It's all set out on tables. Everyone is wearing masks, gloves. Existing pantry members go to a window and they just show their card or their name, and they're checked off by the staff inside through the window. And new people to the pantry, we're not taking any paperwork whatsoever. There's no application. There's no pens being exchanged, so that everyone can stay distant. We're just keeping track of how many people are in the family.
Okay.
And we're serving everyone that comes, regardless of your community. And then we're just tracking the numbers.
Okay.
And as soon as people get to the site, if the bags of groceries are ready to go, even if it's early, our pantry is usually 4 to 6 or 2 to 4. If the people are there, we start serving them. So again, it avoids the line, and that's worked very well.
Okay, great. Thank you. And you said we had a caller, Mr. Cochran?
Not as of yet, but I actually I was hoping that maybe Kit, you might be able to comment along those same lines, because we're so appreciative of what your organization has been doing, but I think it's important to let folks know that you're also staying safe as well as you do these tasks.
Yeah, and they are great questions to be asking. So right now, Malden Neighbors Helping Neighbors takes in donations from 10 to noon, Monday through Friday. So the way that works right now, the building is locked and a limited number of people are permitted inside at a time, less than 5, and there's rarely more than 2 of us there. So whoever is on shift, we're relegated right now to the cafeteria in the senior center. We have a bunch of tables set up. So every day a new table is labeled with that date. Anything that we get donated by a volunteer immediately goes to our quarantine tables. And we don't take anything out of quarantine for a week, so that we can at least feel good about that. We always wear masks and gloves inside of the senior center and have sanitation supplies available, both alcohol, liquid, and also hand washing availability. We have access to the kitchen as well.
So Kit, as a result, the volunteers in good shape? Have we had any incidents?
Yeah, so no, we haven't. So what happens with the volunteers is anytime someone volunteers to help, we have a group of people, we call them neighborhood point people. They're connected to a specific ward. So the person connected to that ward reaches out to the volunteer, and we have an onboarding series of questions. Anytime we reach out to a volunteer, we ask if they or anyone in their home has been sick. And we mark them as such in our sheet so that we don't, if someone has been sick or is recovering, they don't get tapped for anything. If people work in roles where they are interacting with the public often, or if they're medical professionals, we're not going to send those people to do deliveries to immunocompromised individuals. So there is that layer of due diligence being done on our side. So, and all volunteers are required to wear masks and gloves for drop-offs, and we will provide them if the volunteers don't have them.
Okay, great. And Christian, same thing over at Cambridge Health. How's the staff doing? I know there's a lot of work being done in the Malden facility.
So, we are coming down from our surge, and I think the staff now are finally starting to take a breather and are starting to, just sort of, I think, reflect on the past 7 weeks. As a system, we were one of the first hospitals, literally, I can tell you that on a Wednesday evening, I made my rounds to all the various departments, checked in on the different groups, and things were relatively normal. And literally the next morning, every single ICU was full, and it just flipped like that. And so I think they were really forced into a situation where they had to gear up like instantaneously. And so I think, over the last couple of weeks, as we've started to see fewer and fewer cases, they've started to, decompress a little bit. I think some of them, this has hit them really hard. And so, others are taking it in stride. And, I think they're reflecting back on just what they went through the last 6 to 7 weeks. Not only just the nurses, but the staff, the allied health professionals, right, and the providers as well.
Okay. All right, Mr. Cochran, is there another question you said came in?
Yeah, Christian, we're going to stay with you on this one. We've got a couple of questions just about some gear. First is, there's been a debate about gloves and the effectiveness. Shouldn't you wear them? Would like to hear your perspective on that. And then also, if you could follow up, how has equipment been within the hospitals? We heard so much about ventilators and PPE and shortages and things like that. Maybe you could talk on that as well.
Sure. So I don't recommend gloves. Gloves are really designed for medical personnel who are interacting with a patient, and then they remove the gloves and the gloves go in the trash. The public wearing gloves, while it might feel like a security blanket, it's doing you no better. In fact, I think it's actually doing more harm. Why do I say that? I say that because the vinyl material that is in the glove picks up more viruses and bacteria, and it stays on there longer than just your regular skin. So, the virus isn't going to go through your skin. It's not going to go through a cut. It's not going to go through your nail beds. It's something that you have on your hand, and you put it up close to your face. So if you're wearing a glove and you have an itch on your face, naturally your intent is just to touch your face. Well, with the glove, you're already going to contaminate yourself if you don't have your mask on properly. And so, people might feel good having gloves, but they're providing no added protection. And I think sometimes they're probably a greater risk for the reasons I stated. I don't recommend gloves. I think gloves belong in the healthcare setting where they're used for that one patient encounter. And then as the nurse or the provider leaves the room, they take off the gloves. They do not keep the gloves on.
Christian, we should have had you on 7 weeks ago. Because there's been a lot of debate on that. I mean, I'm looking over at our chief of staff, and just today we were debating the pros and cons of gloves. So it's good to hear your perspective on it.
And we've had the same issue, I think, in the hospital. But once our infectious disease teams, we were able to sit down with the staff and help them understand. We've even done the little blue light experiment with the staff, and they got to see why the gloves are not appropriate in the hallways, out on the street. And we've been for the most part, I think we've been almost universally successful in convincing our staff that gloves really are not a safe approach.
But let me ask you, Christian, we've, recommended to our seniors that in a building, if they're, skittish about getting on an elevator and pressing buttons, to use gloves. Are you saying they don't need to, or?
I don't think gloves are, I think is better than anything else. Honestly, I think a little bottle of Purell is probably more effective than a glove.
Okay.
I think, I don't think it's, terribly bad to have a glove on, but if you're going to have that glove on in the elevator, you got to take it off right away. A lot of times what I'll do is I'll push, I keep a little bottle of Purell with me. If I'm in a public elevator, which I don't really get much into because I can't seem to get out of the hospital very often. But when I touch an elevator, I just put a little Purell in my hands and I clean my hands.
Well, Christian, be prepared. You're probably going to get some calls tomorrow from the glove making companies because you just lowered their stock. So be prepared for that. I think we have a call coming in, Mr. Cochran.
Nothing as of yet. Actually, we took it. We went ahead with our calls, but I'm gonna. I take that back. I just got the message from Chalonzo. Thank you, Patty. We have Patty on hold here. Go ahead, Patty. You are on the air with the panel.
Hey, Patty.
Hi, Gary.
Hey, how you doing? Good to hear your voice.
Well, this is over. You think eventually they will open the senior center? Because I like to go, get out and join things.
I know you well.
I'm under psychiatrist and a therapist, and they want me, to get out too and do things.
Yeah, Patty, we're just starting to talk about, the reopening of the government.
Yeah.
But I have to say, I think the senior center will be one of the last, buildings that will come back online, just because of, what we're seeing on how the virus is affecting different populations, most notably our seniors. So we want to be very careful there, until we have a better sense.
So we probably maybe sometime in June or July.
Yeah, I don't want to give you a date, because just the we don't know the unknown of the virus, and I think Christian from the Cambridge Health Alliance can add to it, but we're going to be very careful. Again, as I was saying at the outset, we've come a long way. And so we don't want to do anything that, forces us to start over from where we
everything here
were.
in the building, everybody's fine. They don't have it, no harm wood, the whole virus. Nobody, Green Street.
That's great to hear. I mean, we should end the show right now on that note. But as I've always said, Patty, you're one of the strongest I know, so...
Yeah,
just keep doing what you're doing, and let's hear from Christian on, what he thinks regarding senior centers reopening will be. I mean, do you have the same thought, Christian?
Yeah, so my worry is certainly with that population. I think we need to be measured, and I think we need to take a very cautious approach to congregant type establishments. And we really do need to be just mindful that, while some people might feel fine, this disease has had a very devastating effect on others. And, the senior population, I think, has been a group that has been so heavily impacted by this disease. But I've also had a lot of younger people who were relatively healthy, who, had a hard time with the virus as well.
Yeah.
So I think all age groups are affected by this. Predominantly the, groups, 20 and older have been the groups that have been the hardest hit. But I do agree. I think we need to have a measured approach when it comes to opening up certain programs throughout the city.
Okay, so Patty, you're going to have to keep using the bike path.
Huh?
You're going to have to keep using the bike path until we open the senior center, okay?
Yeah, right.
Just don't do what you typically do, which is pass me 3 times to my 1 time using the bike path, all right?
I mean, I don't think, working on this virus, the vaccine or something.
Well,
I hope they're working on it.
Yeah, let's ask Christian what his opinion is on when we will reach that status. What do you think, Christian, on the latest information you have?
I think we're at I think we're at least into early next year. I think before that happens, I think there are some vaccine trials that are showing promise, particularly one, Moderna out of Cambridge. But I think the challenge we have with the efficacy of any vaccine is exposing, prophylacting a group and then exposing that same group to the disease to see if the vaccine is successful.
Okay.
And obviously there's a lot of ethics around doing something like that. And so unless you get enough people in the population to be vaccinated, and then having the disease prevalence still up in the environment, it's hard to know how effective the vaccine is going to be. I still think that I think the earliest we're going to be is early next year.
Okay.
I hope is that we can get something later in this year that can be included in some type of flu vaccine, but there still remains a lot to be answered around. Is this going to have to be an annual thing? Is this a one-time thing? I still think that we have a lot to learn from.
Okay. Thank you, Patty. Hang in there.
Okay, our next question, Mr. Mayor, is from Facebook. April asks, will there be a high school graduation this year?
Hopefully, yes. Notice I went before Christian responded. It was scheduled for the end of May, and I think some cities and towns throughout the state and the country have just outright canceled it, but we're holding out hope that we may be able to do something in August. I think it's around mid-August, April, where obviously we'd have to have all the protocols in place, but the hope would be that we would have it at McDonald Stadium like we were planning to do at the end of May. So just, bear with us as we try to figure that out, and fingers crossed that we'll be able to make this happen for you and your fellow classmates. I mean, Christian, am I speaking out of turn on that? I mean, if we did, depending on how things unfold during the last part of May, I mean, August seems like it's a long way off, but is there a chance if we had protocols in place to be able to do something for our seniors?
I mean, high school graduation is such a memorable time. I still think we got to be very, very cautious with any type of, I think the state police graduation last week was an interesting one, where they were able to pull that off, but they didn't have anybody in attendance.
Right.
My biggest worry is the one person in the crowd that is, takes off the mask, and then we have a problem. I think it's okay to plan. I think you should still be very cautious about how you do this.
Which we will. But April, in lieu of that, I know Principal Mastrangelo and the teachers and the staff, they are organizing a parade at the end of the month to coincide with what graduation would have been. And they're going to pass by all the houses of our graduating seniors. So the police they're involved, the fire department's involved. So more details to follow, but I was on a Zoom call this morning, and it's starting to come together.
Okay, we do have a caller. Before we head to our caller, we did want to ask, we had another question come in, and that is going to be of Kit. And Kit, we'd like to know what is the makeup of the volunteers that you guys have having? Are we talking, from the very young to the very old? Is it all parts of Malden? Is it outside of Malden? What's the number? Do you have a number of volunteers that you know about?
Yeah, that's a great question. So at the kind of organization level, the folks who are doing the triage and organizing our volunteers, there are about 20 of us. So people who are working what might be considered part-time, helping out. So a lot of these people work day jobs. They are working from home and are able to help us out when they're not taking care of their kids or working from home. We have 320 Maldonians who volunteered through our website or through our Facebook page. And then we have a very active Facebook group. So even people who haven't signed up to volunteer with us directly have helped people in the community. I see a lot of, I haven't been able to find toilet paper, or I need blue bags. Is anyone going shopping? Or I need 3 things from the grocery store. Is anyone else going? And almost automatically responses happen. I mean, what's been really inspiring is watching the community come together to help one another at this time.
And Kit, I know our Chief of Staff has been able to work with you where you now can start accepting donations?
Yes, that's right. So I have been working with the city. We have a fiscal sponsorship now, which means that we can collect donations. So there, again, at maldenneighbors.org, which is our website, there's a donations tab. And if you go in there, there are 2 ways to donate right now. You can either write a check to Malden COVID-19 Relief Fund, and that is on the website. Or we have a Venmo that is open where you can send money digitally. And that is going toward things like buying groceries for folks who can't afford it, picking up people's prescriptions, other like emergencies that are coming up. Up to this point, volunteers have been paying for things themselves and then getting reimbursed by other volunteers who offered money. So this should be a slightly easier way to make sure that when volunteers go out and do something that they get compensated for it.
Okay, great. All right, Mr. Cochran, do you have another caller or question came in?
Yes, we do. And just to confirm, that donation Venmo, which I actually just looked at it on the website myself, looks like Malden COVID-19 Relief Fund, all one word. Looks like that's the Venmo account.
Yes.
As soon as I get off this call, I'll be sending something your way. So thank you very much for all your help. We are going to go to our caller. Marie is on the line. Go ahead, Marie. You are on the air with the panel.
Hi, Mayor, or Gary, or the panel.
Hi, Marie.
I know, I always have questions. But I want to know, before everything opens up, how can we get tested? Are we allowed to get tested through the Health Alliance, even though we don't have symptoms?
Yes, and we'll have Christian give you an overview as well as the contact information if you were interested in being tested. Christian?
Definitely. Thank you.
So we do, yes. The Cambridge Health Alliance took the first step. We're the first health system in the state to start testing asymptomatic residents for the disease. We have found, in some communities, upwards of 17% of the residents who tested positive were asymptomatic. And this is what's important about this is that the person did not even know that they had the virus. And so what's happened is they've been out and about they've had close contacts in the household and they've been shedding the virus. We will not get control of this if we don't start focusing on widespread community testing. So the Cambridge Health Alliance as a whole, we started in Somerville and then moved to Malden and Everett to test anyone in the community who wants to be tested, regardless whether they're symptomatic or asymptomatic, meaning they have no symptoms. Some people have actually been surprised by the test, and so it was helpful for them to understand that they needed to isolate and quarantine themselves. We've worked with the Malden Board of Health, and they are we will be giving the results directly to them, and they have been calling in the results to the community. And the great thing about that is that it does give the Board of Health, probably a faster report about the positivity rate for someone in their community, and they're able to start tracking those residents. And there's a whole process that they've been going through when tracking and following those residents. So to me, We feel very strongly that this is a very good community service that we're trying to do, but also allows Malden to know, who in their community, once we get enough testing under our belt, what the rate of positive and negative residents are in the community. So we are offering it. The only requirement is that you must call for an appointment. We are increasing our capacity at our testing tent. So if you give me a moment, I'll be more than happy to get you a phone number that you can call.
I think we have it here, Christian. It's 617-665-2928.
Yep, that sounds like it.
Okay.
Yep. All you have to do is call them tomorrow morning, and they'll schedule you a time to come to the tent. The great thing is that you can come in by vehicle, or if you don't have a vehicle, we offer up walk-up testing. The only thing we're asking folks to bring is a ID with you, just for, because we are a health system, we still have to follow very rigid testing requirements, and we want to make sure that whoever's being tested is the actual person that's being tested. So bring an ID with you so we can verify. If you don't have an ID, you'll need to let us know your name and date of birth so that we can, our nurses out there can verify who you are. We'll do this. The swabbing is very quick. I wouldn't say that it's fairly painless. You may feel a little burn, but it's really just slightly uncomfortable. It's only for a few seconds. But then you should get your results within 5 business days.
Christian, I know you talked about widespread testing. So right now, are you still averaging roughly 300 to 400 tests per day? And if so, what are you hoping to get to per day at some point soon?
So we are about 300 tests per day, and we are hoping to get to 1,000 tests a day. That's what we're hoping for. I do think that once we get, through the summer months, I think that we'll have a good indication of what the prevalence of the disease is in Malden. Okay,
and Christian, in all these conference calls I've been having with other mayors and Mayor Walsh, Governor Baker, they're feeling, you just reminded me that once we get to widespread testing, the next question is going to be what to do with those people who test positive. And they have been insisting that we're going to have to come up with a process where those people do not return home, meaning that they go to a hotel or motel or somewhere other than bringing it back to their families. Is that your feeling as well? And the one thing that has come up repeatedly is how do you pull something like that off?
So it's a great question. It is something that we've actually been thinking about over the last 3 weeks. We are submitting a peer-reviewed study based on household contacts in our catchment area to the Journal of the American Medical Association. We have actually teamed up with a Harvard researcher and several MIT researchers, including folks from our infectious disease division. And we have had some fascinating data that has showed that many of the folks who have been tested and have come up positive end up getting positive either by another household contact. And so this notion that we definitely need to address the household contacts could not be something that we must get on top of this now. I do think that the research has been incredible around this. I think there's 2 schools of thought on this. My recommendation is that we try to pull the COVID negative people out of the home. One, to keep them so that they can continue to keep working. We have found that many of the patients who are positive or are still able to isolate at home are reluctant to leave home. They don't feel well. They would much rather be in their home rather than being in like a hotel. They don't really know that well. They really can't go many places. So we've been sort of advocating for, particularly in these, congregate housing, to try to get the folks who are COVID negative out of the home and keep them from getting the disease and keeping the COVID positive residents inside the home. There are other schools of thought about pulling the COVID positive person out of the home and keeping the negatives in the home. There are, I think it really depends on if there are more positives in the house. But if we don't do this quickly, within days, the whole home's going to be positive. So it's an area that we need to work more on. The challenge is going to be, we've looked at, obviously Tufts University was a great partner with us, but we really need places like hotels and motels that have singular bathrooms, particularly for people who are negative, so that they don't actually develop a disease. We just don't want someone who tested negative, but likely could be having the disease, to be congregating with other COVID negative people and then potentially expose them and make them positive.
Yeah. No,
so I think there's still a lot of work to be done on this.
Agreed.
But it's a critical and it's an important one. And it's something that we need to address sooner than later.
Okay, thank you.
Okay, our calls are complete for the evening. Our questions are complete. So as is customary, we like to go around and give the panel a chance to wrap up. And if it's okay with you, Mr. Mayor, we'll go ahead and do that.
Yep, please.
All right, first we're going to go to Gabby. Go ahead and close us out with what is going on in your area.
Yeah, thank you. Well, at the Bread of Life, please see our website or give us a call if you want to volunteer, if you want to donate. We're on regular phone calls with the Greater Boston Food Bank. The food supply is secure. We still accept all foods like we used to. People are still donating food, and we welcome that. We really need it, and we welcome volunteers as well. So please check us out at breadoflifemalden.org. There's a volunteer form there. And also, if you don't want to get involved volunteering, but you want to help support us, you could donate there also. So thank you. As Kit said, the community is really coming together and making it all possible. Thanks very much.
Thank you.
Okay, well, speaking of Kit, we're going to go ahead and go to you next.
Sure. Thank you for having us on. MaldenNeighbors.org is the website. If you want to volunteer to help, if you want to request help, if you want to learn how to donate, that's the right place to do it. If you don't have access to the internet and you're watching this, I'm going to read the phone number. It is 339-224-4842. So if you're unable to get to the website, you can reach us at 339-224-4842, and someone will help you out there as well. So you need something picked up, you're afraid to go to the grocery store, you need a mask, one of our volunteers would be happy to help. And I want to say thank you to the community of Malden. The people we've seen, young, old, people who've lived here a really long time. I've only lived here for a year. A lot of the folks actually involved early on are newbies, like we're new to the town. So actually having the support from the city, Karen Cologne Hayes has been incredible and invaluable as a resource. So thanks everyone for coming together, and let's keep doing it because we're going to need each other to get through this.
Thank you, Kit. Lastly, we're going to go to Christian. Go ahead, Christian.
Yeah, so I want to thank the mayor, and I want to thank all of you. I learned a lot from you and all the service that you provide. I lived in Malden for 10 years, so I consider myself a fellow Maldenite. But I would also say that, we are, on behalf of all the staff, I want to thank everybody for the community's support in seeing us through this as well. And been keeping in mind that I think as we get closer into the summer months, that we do need to ensure good hand hygiene and mask compliance. I think if we can get good mask compliance and good hand hygiene, I think we could avert a second wave of this. As someone who has firsthand seen what this virus can do, it is pretty remarkable about the extent of the disease. And my hope is that people will take this seriously, listen to our leaders, and will take proper action to protect themselves, and more importantly, protect their loved ones and their fellow community members by adhering to social distancing, proper hand hygiene, and mask compliance.
Great, thank you. And for myself, no script needed tonight for the sign off. Thank you, capitalize, underline, bold, italicize, highlighted, to Cambridge Health Alliance, Malden Neighbors Helping Neighbors, and the Bread of Life. You truly have made a difference. And so I just wanted to say thank you from the bottom of my heart. Thank you to Malden Access Television. And I know one of the things that people have been doing in trying to fight off this virus is to read a lot more. And so I'll be doing just that tomorrow morning with the return of Mayor's Story Time, which will take place at 10 a.m. Through our Malden Public Library. So we look forward to seeing you then. If not, we'll see you again here next week, Wednesday night at 7 p.m. Thank you, everyone, and please stay safe.